introduction made me blush a little there. Before I go into any specifics, I thought I'd take you through a small journey that we've been through at Apollo at Chennai here. So just a brief outline about heart failure. About 26 million cases of heart failure are diagnosed worldwide, and they expect almost 37 to 38 million cases to be actually there, including undiagnosed cases. Did you know it's the #1 cause of hospitalization in the world today? And we have a 1 in 5 lifetime risk of developing heart failure. Why is that? Why is it the #1 cause of hospitalization in the world today? It's like every road leads to Rome. Increasing life expectancy, hypertension, diabetes, heart attacks. Everything finally damages the heart and ends up in heart failure. Now, these patients have a very poor quality of life, mainly because they are short of breath and their life is marred by repeated hospitalizations for the shortness of breath. Mitral regurgitation is a significant component, worsening outcomes in these heart failure patients. Now, I want you to look at this diagram of the heart. My pointer was there. This pointer is not working too well. There we have of the heart. And this is the aortic valve, and it's the outlet valve of the heart. So blood comes in through the mitral valve from the lungs, okay? When the mitral valve gets damaged, when the aortic valve gets damaged, we replace it with a TAVR. What is the MitraClip? Basically, it's a tiny clip, not different from any small paper clip or a clothes clip. It enters the heart, looks over the mitral valve, as you can see. That's the mitral valve hole, and we can rotate the clip in almost 360 degrees. We find the exact place where the valve is leaking from, go under the valve, and just clip it in real time. Can you imagine? The patient's heart is beating. While the heart is beating, we actually find the leak, clip it. Then if we are not happy with the reduction in the leak, we can actually remove it, readjust it until we get the perfect result and then get out. Now, the reason why these therapies work so well is because it's a mechanical solution to a mechanical problem. It's basic physics. There's a pump, there's a valve. The valve is faulty, the pump fails, patient is sick, we fix the valve, pump improves, patient does well. So, even when I put this slide, it brings a smile to my face because this is where everything began. All the way back, 5 years back, November 2018, when an 86-year-old lady with no diabetes or hypertension, who was functional, doing well, suddenly developed shortness of breath while playing badminton with her grandchildren. She was rushed to the hospital and found to have torn a mitral valve leaflet, presented with severe MR. 6 hospitalizations for heart failure and a drastic reduction in her quality of life. She could hardly walk 50 meters, and this 86-year-old who was active, who was swimming, who was playing badminton, got confined to a wheelchair. So 2 clips later, as you can see how the first clip there, we took a second clip right next to the first clip. That was her day 1, that was her day 2 at discharge. And there were several publications on how she, just a few weeks after her MitraClip procedure, went on to play badminton with people her own age and even her grandchildren, right here at the Taj. We also published this in a national journal and documented that we had performed the first case and how well she's doing now. Incidentally, she is now 90 years old, doing extremely well, was hospitalized once for COVID, recovered fully, and has had not a single heart failure-related hospitalization from the date of the procedure. So, several patients with heart failure come to us at Apollo every month. This is an 86-year-old man, diabetic and hypertensive, had a massive heart attack, severe MR, cardiogenic shock, kidney shutting down, liver shutting down. You can look at the WhatsApp message where he says, "Doctor, we are in Bangalore, we are in ICU, we are not able to remove Papa from the ventilator, we are rushing into you in an ambulance." And look at this, this is an actual echo image of us performing the clip. Look at the clip, look at the leaflets of the heart bouncing in and out. And in the next image, you can see how we have trapped the leaflets. And the leaflets are no longer moving. And the clip later, After almost 2 weeks of being on ventilator, unable to come off, that is him. 24 hours later, that's him 1 week later playing with his great-grandchild. Another heart failure patient, 72-year-old man, diabetic and hypothyroid, angioplasty in 2005. Severe biventricular dysfunction, heart function of only 25%, severe MR, trying to rush over with the air ambulance in Delhi, refuses to take him because he's so sick. Am I speaking too fast? This is okay? It's okay? Okay. So the first air ambulance refuses to take him. He finally manages to come in the second air ambulance. BP is 80 over 50. You see those bright red colors? Those bright colors are a torrential leak of the valve because it's not working. And you can see after the clip it's become almost nothing. From BP of 80 by 50, within minutes after the procedure, his blood pressure is 130 over 70. His kidney function continuously improved. His liver function continuously improved. This is him 12 hours after, that is him 36 hours after, and that is him a week later saying that he's doing well. 80-year-old, let's see, these stories go on and on. In 2019, a post-cardiac arrest survivor came to Apollo from Bombay and we clipped him. Every month from 2019, he sends a message saying, "Good morning, sir, thank you for this miracle." Because they had said that he would not survive. He used to spend months without being able to sleep, just leaning over his bed. Look at the son's message. We used to have coffee at 4 o'clock every morning because my father used to sit and he could not sleep. This is the first time he's sleeping. I said, and I'm missing my coffee. I said, it's a good thing to miss. Every day at Apollo Chennai, every month, we get at least 3 to 4 air ambulances. People come from across India, across Asia, because not only do we have the highest number of MitraClip implants in the country, with over 70% of all cases being done here, we also have the best outcomes. All our patients do well. So these are several messages. Now, over the period of the last 4 or 5 years, we have done all this work. Why am I here in front of you today? We have published the first 7 high-risk cases that we performed in the Indian Heart Journal, and also co-authored the Asia-Pacific Consensus document for on what kind of patient should be clipped. Now, why am I here in front of you today? Because this patient I'm going to talk to you about is something special. Normally when these patients come to us, they either come to us with an aortic valve that's damaged, that requires repair, or with a mitral valve that's damaged. It's not often you get unlucky enough to have 2 valves damaged. And both damaged at the same time, so badly that unless you fix both, you won't recover. So this was the story of Mr. Deshabandhu, who is a Sri Lankan. He has some children in Australia, some children in the UK, and is a family full of doctors. So in 2019, he was diagnosed with both his valves, the aortic and the mitral, had disease. He was diagnosed with aortic stenosis and mitral regurgitation, but it was not bad enough that needed intervention. And over a period of a year and a half, the valves became so bad that his quality of life was terrible. He was almost bedridden. He had very unique anatomy. When you look at this image, can you see these? Look at my pointer. Can you see these? Pointer's not very well. Can you see those little white spikes in the circle? That is calcium. Now, the problem with this calcium is, this is a little bit of a drawing of mine to help you understand. When I put a new valve into that place, the calcium will keep the valve from fully opening and won't leak from the side of the valve. So even though he took several opinions from doctors, they said it cannot be done. Because if you put a valve and leave it like this, there will be tremendous leaks from the side. And you don't put a valve, then the patient is too sick anyway, and you put a valve and put a balloon, you'll break the calcium and rupture his heart. So we managed to get the valve, that is the aortic valve in place. Can you see all those black lines, like little clouds on the right and left of the aortic valve? And the karpa in the right side, that is actually the mitral valve full of calcium. Normally, only bones look like that. And this is the torrential leak. And the bright color, so that is the leak. and after the clip, the leak is gone. The minute the procedure is over, LA pressure, heart pressure and this is a 3D view. Clip of water you can see the two holes, and on this side you can see both the aortic valve and the MitraClip in the same patient.
He had no clue. This still have, but you're practically normal within a day. So it was a very complicated case for Dr. Sai. Very, very complicated. He is recently diagnosed with double valve damage, which is aortic and mitral valve, but this time around complex procedure. We received several opinions from Sri Lanka, Australia, UK and US. Later we were informed by our physician the only person who can attempt this complex procedure is Dr. Sai Satish in Chennai.
I had developed a breathing and now I am very normal after both the proceedings done. I didn't feel that both were done. And now I am like a normal man I can breathe now. And this, I am very grateful for Sai.
Even with cardiac arrest and several complications, we still got TAVR and MitraClip done successfully.
Procedure that is I procedure
This procedure was no pain and less hospitalization, and we are flying back home tomorrow. I have several doctors in my family, and I can clearly say only a few people are going to be doctors, and Dr. Sai is one.
So in the video, this is the first time the daughter is telling the father that he had a cardiac arrest, because he didn't know. So emotional because she's looking at him saying, "You gave us so much trouble, you'll never believe. They came from Sri Lanka, in hospital, cardiac arrest, massage, shock, revived, took him to the lab, and our jolly over the way Nadakar is lying down saying, I am feeling perfectly fine." But one more important thing, you know what these patients say? The first thing they say is, "Parana ungalukalla, neenga moochi edukrappo, neenga moochi edukradha ungalala unara mudiyala." That is, we breathe subconsciously, we don't realize we're breathing. But when they are sick, every breath they can feel. And the first thing that happens after therapy like this is they're able to breathe without realizing they're breathing. That is why he says, "My breath is normal." This is a beautiful picture. I went to Sri Lanka about 2 weeks after to do some cases, and Mr. Deshpande came walking, driving his own car at 75 to have a cup of coffee with me at the hotel and say hello. So thank you all so much. And with that, I will allow
some achievement or the other. It actually makes me very humble, because it just goes to show that some family somewhere needs help, needs treatment. It also goes to show that they actually trust us and the Apollo team. And I think that is the reason why, 24/7, all over the country and in some other parts of the world too, that the Apollo team is actually fighting non-stop to see that lives are saved, fighting non-stop to see that the best possible in terms of technology comes to people of our country, and I think that's really what today is all about. I know and we're excited that Dr. Sai, and Dr. Sai is literally a soldier leading from the front, and he will stop at nothing to save a patient's life. So today when we're celebrating numbers, I think numbers is just a number out there. It's the outcome, it's the care, that is what we're celebrating. And we're thankful to Dr. Sai for even giving us an opportunity to celebrate. The patient's families celebrate the fact that their loved ones are looked after. We from the Apollo team celebrate the fact that we can bring the best in class and be so proud that something like this was done. It's not easy to do 450 TAVR procedures across the globe. Sometimes it's easy to get up in the morning, just come to your own hospital, do the procedure and go back. But if you have to get on a flight, sometimes 4 flights in one day, and do these kind of numbers, it just shows that an Indian doctor is just so amazing that he can do something not only in our country but be respected in other parts of the world. The fact that MitraClips were done, and to do it as a combination between a MitraClip and TAVR in one shot, again takes a lot of thought, a lot of skill and a lot of courage, and I think he's done that. To me, it's just the first step in the right direction, because I feel that when you take that first step to excel and to do something dramatically different, nothing can stop you at this point. So I think while we're congratulating Dr. Sai, I think it's the entire Apollo team who works, whether they're in administration or whether it's the nurses or whether it's the anesthetist, whether it's the housekeeping boy who sees that everything is infection-free. I think the team has to come together and systems and processes have to be in place. And I think that is really the phenomenal legacy which Apollo has built over the past 38 years. It's nice to acknowledge the fact that many firsts were done, and I'm going to call those out. The hospital and Dr. Sai was the first to perform the MitraClip in India. And when I was asking about numbers, I think we don't have data yet, we will get it, that we are the leaders in Southeast Asia itself, and I think that's a great achievement. Again, the first time that 4 MitraClip procedures in a day. In Japan also it was only 3. So while it seems like it's a numbers game, it's only a proof of the expertise and the speed with which they now for the first time in Asia to perform both the MitraClip and the TAVR procedure in the same patient, again goes to show that we as Indians, our Indian doctors are setting for that. The good thing here is that the next day after TAVI, sometimes patients have a heart procedure, they are in the hospital, it takes a long time, but here they get discharged the second day. And multiple other formats that we have done for the first time, and the list just goes on and on. But I would like to say that at Apollo, it's the unswerving focus on patient outcomes, the commitment and passion to bring the best in class, and it's supported by phenomenal doctors and a great support team. So for the members of the press and the media, I can only say thank you. That when you come and attend an announcement from us, you're just putting India on the global map for being phenomenal. While our Prime Minister is constantly talking about Atmanirbhar, I think today this is completely a proof of being Atmanirbhar. I'm so proud to be an Indian, and we will continue to do as much as we can for the people of our country and put India on the global map for healthcare constantly. Thank you.
Okay.
Sir,
Done.
sir, ma'am, madula sorry.
Two staff nurse teams, everything was double. So by the time I finish in one lab, second lab will be ready, switch to that lab. By the time I finish, first lab is ready, switch to this lab. And by the grace of God, each procedure took about 10 to 15 minutes. It takes a lot long. See, most of them, the procedure is done fully conscious. Nowadays, we've become quite experienced. We don't give general anesthesia. See, MitraClips have to be done under general anesthesia. But TAVR, we just bring them in sedation, drop the valve, send them out. Sampath is laughing. He's waiting to go back to play volleyball.
What is the most challenging thing in this?
See, there have been so many challenging cases. You would have seen from my presentation that so many air ambulances come in. Patients are old, patients are sick. Because of COVID, they wait for the last minute. Not only that, most of them are not aware that this therapy is there. So by the time they come to us, they're very sick. But that is not the worst part. The worst part is infection. See, all these patients have heart failure. Because of heart failure, they are in other hospitals with catheters, with IV lines, with necklines getting treated. And my biggest nightmare, my whole team, it will not be fair if I don't mention my team, which is Dr. Hema and my colleagues, Dr. Y.V.C. Reddy, Dr. Abraham Oman, Professor Chandrasekhar, without whom I could not have done what we have done. They are like pillars, you know. So Ram Gopal Krishnan, Dr. Ram Subramaniam, our anesthetists, Dr. Ganapati, our staff nurses, our cath lab technicians, the list goes on and on. It is not possible to do, I always joke and tell people that I am hospital because I can only do what I do with all these people around me. You know, Dr. Anita, the CCU team, but my biggest nightmare is these infections because we will go in 2 minutes, do the perfect procedure and come out. And then the patients will limp and we won't understand why. And they will have had a catheter or urinary infection which will go to the blood. That is the worst nightmare.
Hello, Doctor. Doctor, I have a couple of questions. One, can you explain in detail a bit more?
In our blood vessels and around the valves. Now the problem with calcium is it takes tissue that is supposed to be soft and makes it brittle and breakable. Now when you have calcium that's forming shells, literally like in the Guhakala Park, stalactites and stalagmites. On the Guhakala, you see these stalactites. These bloody things protrude inside the vessel. So when I put the valve won't open. Now if I put a balloon and try breaking it, it will rupture. If I don't break it from the side, koto. So the trick was, when we analyzed the CT, it is 3-dimensional. So we found that some places it's 6 millimeters, some places 4, some places 3, and at one place it was 2 millimeters. The aim was to get the valve in and lock it in that place so that 2 millimeter area exceeds and you don't have margin for error. Now the heart is beating. When the heart is beating, the heart is rocky. See, the heart just doesn't beat in one place. It rotates on itself and beats. So what we actually do is we put a pacemaker and we pace the heart. It's a very technical question you asked me. We make the heart beat at 200 times per minute. Now what happens when the heart beats at 60 times per minute? It squeezes, relaxes. Squeezes, relaxes. 200 times per minute, it's just doing this. So technically it's not moving. And I use that to my advantage and get the accuracy and deploy the valve. So this is with the aortic valve. First I thought adla tappichiruven. Appuram paathukalam. But what happened is even after I fixed the aortic, the mitral leak was too much. You know, he developed a cardiac arrest, he was sick. So we actually gave him general anesthesia. And you saw in the video I showed you, the whole mitral valve was captured. So there were rocks and boulders everywhere. Now the biggest enemy of the MitraClip is it's a tiny clip, it's about 15 millimeters. This clip has to catch the leaflets. Now if I catch bone, it will peel off and fly off. So while the heart is beating, while this leaflet is flapping, I have to find an area which is in the leak without calcium and clip it. So it is like playing a video game with very high stakes. But sometimes when your intentions are good, you've had good training, good teachers, you have a great team, and above everything you have a little bit of blessings from the one above, things work out and you get results like this.
Thank you.
Okay? When the valve is not closing and there is a torrential leak happening, then you use a MitraClip. It is for a leaking valve. Now this leaking can be because of two reasons. One, so you can either have something called a degenerative mitral regurgitation, where there's damage to the valve and there's a leak, or functional, where the patient has multiple heart attacks. The heart muscle dilates, and when it dilates, the mitral ring moves apart and the leaflets don't reach each other and there's a leak. So for any leaking mitral valve, you can use a MitraClip. Adapting technologies, adapting things from different cultures and using it to our people. As such, there is nothing purely original in the world. Right? Very few things. Now when TAVR valves came in, we only had the imported valves. Now India has started making its valves. So we can be Atmanirbhar. Like that, we have brought the clip. We are doing the clip. The results are being shown. I am sure that big companies will think of the Prime Minister's dream, and I'm sure that we'll have clips made in India and we'll be Atmanirbhar.